We're continuing our discussion of hospice care on Daytime, and to mark Hospice Awareness Month this November. The role of hospice for families has changed over the years, and here to discuss how hospice has evolved is Cindi Barrick, Vice President of Clinical Services for Hospice of Central Ohio. Cindi, nice to have you here.
Thank you for having me.
Hospice of Central Ohio, you've been around for 30 years.
Correct.
And I'm sure you have seen a lot of changes. So what do you say are the most marked changes from, say, 20, 30 years ago?
One of the biggest changes we find is that most hospice patients traditionally at that time were cancer patients. In today's market, there are a number of life-limiting illnesses that we're able to serve in hospice care. So it's helping folks understand that there are a widespread of disease processes that we can help in that hospice setting.
That's interesting that you say that, because now that I think about it, you're right. That's what people thought hospice was for traditionally, cancer patients. And we know now, and because hospice has evolved as well, the care is for anyone.
Correct.
Okay.
Yes, it is.
You are located in Lancaster. My question to you is, do you have a widespread area that you are able to serve folks?
We do. We actually have an office in Newark, which is our main campus, and we have an office in Lancaster and soon in Columbus. But we span 8 different counties. Oh,
my golly.
Yes. Licking, Fairfield, Hocking, and Perry are a couple of new counties, Muskingum, Delaware, and into Franklin County.
How would you describe your different levels of hospice care that you offer to patients and their families?
It varies from the routine, what we call routine home care.
And how would you describe that?
That is where we're coming in and making an intermittent visit. Different members of the team are coming in to provide care, and we're monitoring their physical symptoms, but we're also dealing with their emotional and spiritual issues as well, and providing assistance with their ADLs. That's a routine level of care where there may not be acute symptoms at that moment in time. Higher levels of care that we can take care of are crisis care, which that is where we provide nursing staff in the home to stay with the patient and help support the family, manage the symptoms, and provide interventions during that period of time of crisis. Mm-hmm. Once the crisis is resolved, then we go back to a routine level of care.
Do you also go to different care centers for folks if that's where they are?
Yes, we do.
Okay.
We do. We serve patients in their home setting wherever they call home. It might be a nursing home. It may be an assisted living facility. It could be, anywhere that's home.
You also say that you provide palliative care services. What does that mean? I mean, how did you describe that to people?
That is confusing because hospice and palliative care have been used interchangeably for so long, and we palliate symptoms. The difference is that hospice is a life-limiting illness, whereas palliative care is symptom management for folks that have any number of disease processes that is not necessarily life-limiting. But
they're chronic.
They're chronic. They may be seeking curative treatment at the same time, such as the cancer populations that still have a need for palliation of their symptoms, but can still be seeking curative treatment at the same time.
I know there are different kinds of hospice services, some for-profit, some not-for-profit. What is the difference so that folks know?
Well, the main difference is that a for-profit has a different tax status. They pay taxes and they have shareholders, whereas a not-for-profit is not responsible to the shareholders. We're able to actually reinvest in the community as well as back into patient care and provide additional services with those funds.
It is wonderful that you offer your services in so many different counties, because there are, in some of these counties, and I know you know that, Cindi, there's just not a hospital there or anything that can really help some of these folks.
Absolutely, and the goal is to be able to serve more patients. More folks surveyed responded that they would prefer to be at home and not be in the hospital, and that's our goal, is to be able to provide that in their home and help keep them from returning to the hospital.
Well, Cindi, it's wonderful that you offer these services in such a wide range and area. It's nice to have you here. Thank you.
Thank you so much.